people. Lots of options. There's a lot of practitioners out there that got vendor booths as well that do this kind of work as myself and looking at integrating all these kinds of things to give people support for sleep, support that they may need beyond those lifestyle things to help nurse that adrenal gland. But if you want to do some bees, some fish oil, get out, exercise, you are doing huge favors to your entire body. Ultimate Stress Eliminator is the newest product. I think it's being launched this week. It is at a vendor booth as well. And they are drops. But when you're feeling a little overwhelmed, a little bit, oh, the stress is getting to me. I'm not quite wired. I'm not impatient intolerant yet. But I'm just feeling a little overwhelmed. And it could even be before going into a big meeting or getting on a plane. Any kind of stress situation, these drops work like that. Homeopathic nature, 6 drops under the tongue. So we have a lot of option of natural, non-addictive things that are there to help us. What about prescription drugs? If these things don't work, and you notice they're at the end, they're at the top of the triangle, they're not what we go to first. It's everything else about lifestyle and eating well and exercise that make that sleep quality wonderful. But if you've done that, and you've done some good natural things, and you're just not calming enough for sleep, and those brain waves aren't what they should be, we sometimes have to move to a prescription drug. And I will tell you that at the end of the day, the danger of not sleeping, okay, so the risks of not sleeping are like this compared to the risk of the drug. So do everything else first, but do not leave yourself not sleeping and not take a treatment, because you are doing your body way more harm. And when we come to prescription medications, that is the question you have to ask yourself. What is the harm of me not treating? Okay? Versus the risks or side effects of the treatment. And that's what really has to guide you in moving to that next step. So there are some antidepressants that actually worsen sleep quality. That you want to make sure that you're not on one of those and you're a poor sleeper, because that may need to be switched. There's other antidepressants that are helpful. But some, the SSRI family, so that's your Celexa, your Paxil, Zoloft, they can worsen sleep quality, even though they're taken in the morning. If you're on those and your sleep is great, you wouldn't change them. But if your sleep isn't going well and you're looking for things to do, then that might be somewhere to look. Benzodiazepines. Anybody heard of this family? All the PAMs, lorazepam, diazepam, that's Valium, clonazepam, all the PAMs. They were intended to be drugs for anxiety and relaxation. They weren't really discovered to be sleep drugs. They work for a very short period of time. They do not increase the delta brainwaves, the restorative sleep, and they will deplete natural melatonin. So over time, people end up waking in the middle of the night. If people stay on those drugs, they often need to take a melatonin supplement along with them. Imavane has probably got one of the least addictive potentials as a prescription sleep drug, which is great, and it does improve the delta brainwaves. And there are other drugs coming up that are in the States that are not here that also do that job. But one new area that we're looking at is pain. And people using drugs like Lyrica, which is called pregabalin or gabapentin, they increase those delta brainwaves. And so we're seeing a lot of people in pain using these drugs. They're so sedating that often people have a hard time taking them during the day, which they need for full pain control. So you start with a nighttime dose and gradually work it up, adding in the daytime dosing. But we will be seeing, I am sure, more use of these drugs for people not in pain, just because they're a tremendous effect on these sleep waves and sleep quality. So I am going to stop at this point and turn things back over to Marianne. What we've just looked at here is the whole basis of today, the foundation for wellness, and building on that, sleep as one of those fundamentals and how important it is. Do not sell your sleep short. Looking at decreasing stressors. When I come back after the break, it'll be hormones from teens to menopause, and I'm talking everything. Some osteoporosis, and a lot of love. So stay tuned.